Welcome to this Autism Ontario webinar, Finding a New Normal, How Psychological Services Can Support You and Your Family in the COVID Era. My name is Matthew Lay, and as always, I will be your host. Today, we have a first-timer on the desk, Dr. Stephanie Price, PhD, and clinical and school psychologist. Stephanie, thanks for being with us today.
Thank you so much for having me.
Before we jump into this very topical presentation, I've got some housekeeping items as always. So first off, Stephanie's presentation is informed by a PowerPoint slide. You'll see that changing beside us on the slide deck. Below me is the Ask a Question box. A big part of my job is to get you answers to your questions. So you can submit those questions at any time. We'll review them, and I will aspire to get you answers from Stephanie. There is also a resources section located in the bottom toolbar. And the resources section is jam-packed with helpful stuff, including past webinars, the PowerPoint deck for this show in both official languages, and some other very informative links that will help inform our discussion. And if you have any issues, click on the help icon and we will be there to assist you. So, with all of that out of the way, Stephanie, I mean, I read the title and it sounds very intuitive. COVID is not a flash in the pan. It's been here for a while, and it's going to be here for a while longer, at least the restrictions that go along with it. But, you know, what was the impetus for this presentation? Where was the origin of why you were asked to talk, and what are we hoping to accomplish today?
Well, initially I was asked to give this webinar based on a presentation I did up here in Sudbury, just providing information to families about, you know, what a psychologist or a psych associate can do to support, you know, individuals on the spectrum or their families. So initially that's what I was going to talk about, but then, you know, COVID happened. So it felt kind of timely to, you know, talk about some of the impacts of COVID and then how psychology or mental health services can then, you know, support individuals when it starts to become too much to handle. I think too, to say that.
Sorry, I was going to say, doing research, I was surprised that, you know, what a psychologist can do to help, because when on this desk, I've met with many practitioners like yourself and you know, members of the entire care circle, from parents to people in the school and counselors and all the like. But it was interesting in doing the research that there are a lot of parents or families out there that aren't sure the role that a psychologist plays in this overall care. And that's something that you will, to a certain degree, touch on today?
Most definitely. Most definitely. As a psychologist, we're kind of big picture people, and we try to find as many pieces to the puzzle to try and figure out why someone is having the challenges that they're having. So, you know, for that reason, we play a variety of different roles on, you know, treatment teams or in hospitals or in different agencies. So it's kind of hard for some people, or it's not as clear, you know, exactly what our role is. So hopefully I can clarify some of that today.
Excellent. Okay, so with that, I'll get you started at the beginning here. But with that, let's jump right into, you know, that big picture you were talking about, and get this started.
Yeah, for sure. So, I mean, in life, we are constantly surrounded by different stressors or different problems that we need to solve. It's kind of the nature of being human, is having to solve problems and be able to bounce back and, you know, advance in life and progress. So, you know, on this slide kind of shows on any given day, these are some of the types of stressors or problems that, you know, me as a mom, I might be trying to navigate and manage, you know, my child's sleep, maintaining a household, my work, that kind of thing. Our brain functions on energy. We only have so many resources to handle stress and to problem solve. So when we have kind of a normal baseline of problems to solve, you know, we can fairly manage. But once we throw in some new stressors, you know, such as COVID, it looks a little bit more chaotic. There's a lot more to have to figure out and problem solve. And our brains aren't really designed to handle so much stress for such a chronic period of time. We're really good at handling stressor, like acute stressors that happen in the moment, not necessarily a whole bunch all at once.
So what is the general, are there any generalized stats that are available as yet to, I don't know if you would say like the rise of general anxiety or acute anxiety, or the number of people walking through the door of psychologists since COVID started? Is it quantifiable, this impact on the general population?
I think the research is still new. It's still coming in, and we're still trying to understand the impacts. I think a lot of the research now is based on that immediate mental health impact of, one day life is normal and the next day it looks totally different. Yeah. But we're just starting to learn now, the aftershock of all the changes that COVID has brought on. And I think I talk about it on another slide, but COVID really makes things more complicated for us, because some of the strategies and coping skills that would benefit us in terms of helping to manage all these stressors are they're blocked, they're obstructed, feeling connected to other people, feeling heard, feeling safe, feeling, even just exercise, going to the gym, like everything is that much harder now. Whereas before we might've used some of those strategies to help us manage. Some of the research I've seen though is, especially in terms of anxiety and depression, and even just symptoms related to those are certainly more elevated. I'd have concerns too about like obsessive compulsive type behaviors. So, fears of contamination or consistently washing your hands, not wanting to touch certain things, which, understandably would be related to COVID.
Mm-hmm. Very interesting.
So, in a nutshell, our brains are just not designed to handle so much stress in such a chronic fashion that COVID has kind of forced us to do. We haven't really had a choice. Now, I know I talked a little bit about, some increases in anxiety and depression, maybe some obsessive compulsive type tendencies because of COVID. But for the sake of this presentation, I'm going to focus on, how stress impacts our emotions. So stress itself is how we respond to an external trigger. So without the presence of COVID, we wouldn't have stress related to COVID. Whereas when it comes to fear, I always give this example to my clients, how, I'm absolutely terrified of snakes. So for me, if I was walking with my daughter going for a hike and a snake comes right in front of me, that's fear. That's immediate threat to safety. I immediately feel like the snake is going to hurt me. Whereas anxiety is more future-oriented threat. So my daughter wants to go to the park. There's really tall grass. Then I'm going to get all what if there's a snake there? What if the snake hurts me? What if something bad happens? It's more future-oriented threat. Trauma, on the other hand, is our response after being exposed to something that's traumatic, something that's life-threatening, or significantly impactful to our health and safety. So in a sense, and for some people, COVID could be traumatic. But this is all to say that emotions are all normal. They're all adaptive. They all serve a purpose or serve a certain function. And for us, fear and anxiety is just our poor brain's way of trying to keep us safe and trying to help us survive. Sometimes it's not so rational, but it serves a purpose. So I love to show this picture of a lion when I'm explaining the stress response and how your brain reacts to stress. If we think back to like caveman era, caveman walks out, or cave woman, cave person walks out, sees a lion, immediately, as soon as the brain senses threat, it activates this whole stress response system in your brain and in your body. Oftentimes that response happens before we're even, aware or cognizant of what our thoughts are, how we're feeling about it. It happens so automatically. And the purpose of this is, if there's a lion, I need to do something to survive. I either need to run as fast as I can, or I need to fight the lion. Mm-hmm. And so that stress response activates, your body so that you can run faster, you can fight harder. That's why we feel so many different physiological symptoms in our body: increased heart rate, trouble breathing, sweaty, shaky, upset stomachs, headaches, muscle tension, kind of the list goes on, because the focus is taking our resources to survive the lion.
Right.
And again, our brain is used to acute stressors. So there's a lion, I need to solve this problem. And then it always wants to come back to normal, come back to stable and calm. With COVID, COVID is kind of the lion for us. We don't know where the lion is. We don't know when it's going to pounce. We don't know how long the lion's going to be around. So our brain is kind of in overdrive or on overload all the time at a fairly chronic type of level. Right. We always have to be watchful and be cognizant of where the lion is.
You had said at the start, whether it's imagined or not. I assume that, there's some people that are quite hard on themselves because of the levels of anxiety that they're feeling and or their challenges in dealing with it. Is that common that you find?
Oh, most definitely. The brain is really good. When we're anxious, the brain is really, really good at overestimating threat, thinking that the lion's going to be bigger than it is, or it's going to be stronger than it is, or the lion's going to be around longer than we think it is. Again, it's adaptive, it's evolutionary, because, if we think it's just going to, the lion's just going to walk away, it's not going to be a big deal, then we're not going to, fight as hard or run as fast. So it serves an evolutionary purpose. However, the thing is, that part of our brain, that old brain from the caveman era, is still present in our current brains. So our brain doesn't necessarily discriminate between an actual lion or a perceived lion, or you're late for work, or someone cuts you off, or some of those daily life stressors. It's still the same process that happens, different degrees, different intensities, of course, but our brain doesn't necessarily discriminate between a real lion and a toy lion.
Okay. So what's going on with COVID deniers? Just joking. Logical question or not, but I'm right away thinking that they're not believing the lion is there is basically the scenario.
Well, and it's something I talk a little bit about too, but I could probably do a whole presentation on that. But yes, our stress response activates that fight or flight response. However, a way of when your body is so overstimulated because of that stress response, oftentimes we want to get rid of those symptoms and that feeling. It's an uncomfortable feeling, having your heart pounding in your chest all the time, or being shaky, and whatever symptoms that someone's experiencing. Your brain is telling you you're going to die. There's a lion, you're going to die. You need to do something. Yeah. So why would I want to stick around and hang out with the lion? If I can avoid the lion, if I can avoid thinking about it, talking about it, if I can just pretend like it doesn't exist, then that feels safer, because then I don't have to be as stressed about it.
Right.
So that could be a factor. I'm sure there's a lot of other factors that could be at play, but that could be for another presentation.
Sorry to derail. I think so.
No, it's okay. There's over responders and under responders, and there's everyone in between. Everyone's going to be reacting to COVID differently, depending on their personality traits, their experiences, if they had any other mental health issues going on. So there's a whole host of reasons as to why someone might be reacting the way they are. But even with my clients, the ones who say, no, like I'm handling things pretty okay, and deny significant distress from it, then I ask, well, how's your sleep? Well, now that you mention it, I'm waking up like 2 hours earlier than I normally do.
Right.
Or, I've had an upset stomach or headaches, or, see your brain, even if you're not consciously stressed about it all the time, your brain is still being watchful because it knows that a lion is out there. So
Right.
The degree to which it impacts people can definitely be different.
I believe we're going to move on to the central nervous system.
Yes. So I won't get too far into the science aspect of this stress response. But what I wanted to highlight here is that it's a physiological thing that happens in your brain and in your body. It's not, when they say it's all in your head, it kind of all is in your head, but you are your brain. So when we perceive threat, when we think a lion is there, your autonomic nervous system gets activated. So in particular, your sympathetic nervous system gets activated. That's your fight or flight. It's been described as, that's the gas pedal. That's okay, you need to do something now to survive. That's where, your brain starts to get your body prepared for battle. But again, your brain always wants to come back to normal, come back to calm. So eventually your parasympathetic nervous system gets activated. That's described as like the brake pedal. You need to slow down. You need to start conserving your resources, because that's a threat to your safety too, if you're consistently in that heightened state. So as you can imagine, that, stop and go can be very exhausting, and mentally exhausting and physically exhausting, which leaves you more prone to illness. You have more stress hormones going through your system. Some of your digestive system slows down, your immune system might be compromised. So, and I was talking to someone about this earlier, in that, a lot of the times our threshold during times of stress is so much lower. And maybe you're feeling at the end of the day like you are just done after a day of work, and you crash. Or maybe you're taking more frequent holidays, more mental health days. It's because it's exhausting, all of this stress all of the time. So it's understandable. And to understand that, your brain is just doing what it's designed to do. Doesn't mean it's always helpful. But there's a reason why you're feeling more fatigued, more tired. Maybe you're having more upset stomachs, headaches. I know I'm getting a lot of muscle tension in my neck, that kind of thing. So in children, though, the response might look a little different, because depending on the child, they might not necessarily be able to, tell you, I'm feeling stressed. I think there's a lion out there. Children are really good at showing you through behavior. I have this internal struggle going on, so I'm going to show you by what I do. And I know this very well with my 2-year-old. So some of the reactions you might see in children: fears of separation. So maybe they're having a hard time sleeping on their own. Now they want to sleep with parents, or they don't want to go to school, or concerns about health and safety, their own health and safety, or in their members of their family. Increased sadness, negativity, withdrawal. It's hard to be happy, rainbows and unicorns when you think there's a lion out there. And some generalized anxiety and just being tense and on edge, quick to react. We might also see some more externalizing type behaviors. So they might be more defiant, or oppositional, easily frustrated. Anger oftentimes can mask stress, can mask anxiety, because if I put up walls and I push things away, I'm safer that way. And again, avoidance of things is a huge one when it comes to stress and anxiety. You might also notice that your kids are complaining of more physical symptoms. My mom would always, so shout out to my mom, but she said, when I was a kid, I would say, my pinky hurts. I can't go to school. So, my pinky hurts is telling you, it's probably because I'm struggling with something. Or, the upset stomachs, or my head hurts. Those are some of the bigger ones we might see in children. Or they're actually getting sick more often from the stress because of that stress response, and their immune system might be compromised. Or you'll notice changes in their eating and sleeping. I know my daughter is waking up way too early lately, since she's gone back to daycare. So she can't really tell me that it's a little stressful, or it's a big change or a big transition, but I've noticed it in, some of her eating and sleeping habits for sure. Some other noteworthy things, just difficulty regulating emotion in general, both positive and, for lack of a better term, negative emotions. Just being able to regulate oneself. You might notice some regression in skills. So, changes in language ability, toileting, those are some common, or sleep. Those are some common regressions we might see in kids. Also, some cognitive impairments. And what I mean by that is if your brain is focusing all of its resources on preparing for the lion or being watchful of the lion, it's a lot harder to focus and concentrate and problem solve and monitor myself. So you might notice that, it's just harder for them to get things done. So just being cognizant that your kids are, as much as you aren't operating on full cylinders, your kids aren't either. And especially with younger kids, you'll see some of, themes in their play. If they're struggling with something, you might see it in how they play with dolls, or if they like cars, there might be a lot of crashing and banging and themes of harm and that kind of thing. So those are some of the things to look out for, in kids.
And are you finding any, we have a comment here about someone saying that they feel like they've got a lot of these symptoms. And I think it's very clear when you start, looking at it through the lens of, my children going back to school or whatever it might be, we're seeing it as well. But are there any specific things to look out for children on the spectrum? Are you seeing it present itself differently, or are these commonalities across sort of all demographics?
What I'd say is noteworthy for kids on the spectrum is, so maybe you're seeing more increased rigidity. So really being more insistent on needing things a certain way, seeking some consistency, predictability. I don't know where the line is. I don't know when it's coming. So I need to know everything else that's going to happen. You might notice some increased, again, like problem behaviors. We might see more externalizing type behaviors, more withdrawal. With my kiddos on the spectrum, I'm seeing, a lot more technology use, a lot more video games. Sometimes that's, their safe place. So not to say that it's necessarily a bad thing, but it might be something to look out for. And also like increases in repetitive behaviors or stereotypy or that kind of thing. I'd say would be like the most noteworthy things that I would be on the lookout for.
Makes sense.
So when it comes to stress and anxiety, it's not all doom and gloom. Again, anxiety is normal. It's adaptive. Your poor brain is just trying to keep you safe. However, anxiety and stress can also help to improve performance. So, how I was talking about how our brains are really good at handling acute stressors. This is like, if I was going to the Olympics, I have so much adrenaline going through me, and then, I break so many world records, this kind of thing. When you have some stress and some anxiety, it can actually make you perform better. It can also motivate you. So, giving a webinar province-wide is a little anxiety provoking. So maybe I, prepared a little harder, or, practiced a few times or talked about it more because it motivated me to do it. So stress and anxiety, again, serves a purpose and it can be helpful, but it's once you reach that top of the peak that it starts to impact your performance and things just get that much harder. So A little bit of stress and anxiety is good. Too much is where it becomes a problem, when it starts to really impact your daily functioning, just your ability to get up in the morning, get things done, and your overall, well-being. So I kind of mentioned this earlier, that some of the coping skills or strategies that we would normally use to handle stress and anxiety, they're obstructed. We can't just, for now we can go to the gym, but for a period of time, you couldn't just go to the gym if exercise was something that helped you to relieve stress. I can't, for a period of time, I couldn't just go to a family member's house. Or Matt, I was talking to you earlier about, how it felt to hug my best friend after we were able to extend our social bubbles. Those feelings of feeling connected to others is so important, because it helps us to feel safe. When we say, the saying, misery loves company, it's true. When we're going through something difficult, if we don't feel alone, it's easier to cope with. But COVID can make feeling alone that much more intense. We also don't know how long some of these changes might be present. How long are we going to have to wear masks? Is there going to be a second wave? There's a lot that we can't predict or we can't control, which can really intensify anxiety. You might be experiencing some conflicting emotions. So, maybe you're feeling anxious and worried about going to the grocery store, whereas, you might feel some grief of things that you've lost. Maybe you had a wedding planned this summer and it didn't follow through. Maybe you're feeling some relief being able to work from home as opposed to having to go into an office. So, having to stay home and be isolated might work for some people, but then for others could be quite conflicting. Also feeling some pressure to re-enter the community. So now that we're, up till now, we've been moving through different phases of reopening, but feeling the pressure of having to go back to work, go out into the community before you feel ready can be stressful. Financial stressors. We talked about isolation, and COVID can actually result in serious injury or death. So it literally is that lion out there. Now, what do we do? How can we help?
I know, that's kind of like what I was waiting for.
Yeah.
We're all feeling it
time on the doom and gloom.
Yeah, you're seeing it. I'm seeing it. I'm seeing it in my son and in coworkers and all of that. So where do we go from here? What are the suggestions?
So again, anxiety and stress is normal, but our ability to be, what's called resilient, our ability to face challenges head on and be able to bounce back, adapt, and cope with it. That is what's key. If I avoid snakes for the rest of my life, I'm never going to go in. I'm in Northern Ontario. I would never go into the bush with my daughter because I'm afraid of snakes. Doesn't really benefit my quality of life. So to be resilient, make sure your basics are met. Eating healthy, exercise, rest. Again, your sleep might be impacted. You might not be able to go to the gym, but finding ways of doing these activities safely. Making sure to monitor your own stress level. This one is primarily a shout out to all the parents and caregivers out there. Children are sponges. And even if they don't understand exactly everything that's going on around them, particularly with COVID right now, their brains are so in tune with their parent or caregiver, in that if the parent or caregiver is really stressed or fearful or anxious, the stress response automatically activates in their brain. It's, mom's tone of voice. She's not as animated as she normally is. She's not on the floor playing with me as much. I saw her crying the other day. All these signs will activate that stress response to a degree in the child's brain. So making sure that as a parent and as a caregiver, you're monitoring your own stress level. And then, it's not to say that parents and caregivers will never be stressed, because that's life and that happens. But being able to monitor how stressed you are and then model doing something about it. and I try to, my daughter's almost 3, and I try to do that with her. When she's having a tantrum and I'm feeling stressed, I will get down to her level and I'll say, you know what, mommy is feeling, what did I say the other day? Mommy is feeling a little bit frustrated or angry right now. But I'm going to just take a couple of deep breaths and then I'll be better. And I did that, and my daughter stopped and looked at me like I had 2 heads, but the tantrum stopped, and then she took some deep breaths with me. So it helped to not only reduce my stress response, but it also helped my daughter too. Focusing on the things you can control. So like I said, your brain is looking for predictability, consistency. It wants to know where the lion is. How long is the lion going to be around? So shifting your focus to what you can control. I can control where I go. I can control wearing a mask. I can control how often I wash my hands. I can control how close I get to people, who's in my social bubble. Focusing on the things you can control. And reminding yourself that this stressor of COVID will not last forever. It feels like it's lasting forever. But us as humans, we learn to adapt over time. And, when everything kind of shut down in March, it was a drastic change in our lifestyle. It was very difficult, I think, for most people to adapt quickly to such a change. However, there's some aspects of our world, our COVID world now, that feels almost like normal. Going out wearing a mask feels normal. I remember back in like April going to the grocery store, and I think I was the only person who had a mask, and I felt a little uncomfortable wearing the mask when nobody else was. But now it's normal. We do adapt and cope to things over time, and COVID won't last forever. So reminding yourself of that. A big one, and I know we talked a bit about that earlier, is that avoidance piece. And avoidance, inadvertently negatively reinforces anxiety. I feel so worked up. I feel so fearful of this lion that's going to pounce that I'm just going to stay away from it altogether, because then I won't feel those symptoms, feel that emotion. However, it doesn't take away the fear and the anxiety about the lion. I'm still going to fear the lion until I can face it. Until I spend some time with the lion and realize that, he's kind of nice and he wants to just, be pet behind his ears. Or, maybe I think of the lion as being in a cage, or that I have the resources to handle the lion if he were to pounce. So the more we can, and by no means am I saying go and expose yourself to unsafe situations with COVID, but, trying your best not to completely isolate yourself. Go for a walk outside, go for a car ride. You don't have to see anyone if you do that. Trying your best to, not avoid things that you can do safely. Also, limiting your access to the news. Your brain is already doing a really good job at monitoring the state of things. Your brain is already monitoring where COVID is, when is it going to pounce, and your brain is already doing that. The more and more you feed it with information about the state of COVID, the more anxious you're going to become, because the threat's going to seem bigger. The threat's going to seem more overwhelming. So, it's not to say don't stay informed, but it's just not beneficial to your mental health to constantly inundate yourself with information about it. I've made myself a personal rule of I only check the news, first thing in the morning, and after my daughter goes to bed at the end of the day. If there's anything important, I'm going to find out about it then. And I think, one of the biggest ones that I've been working on with families lately is the stress in relation to school. And I don't know if there's, again, this could probably be a whole other presentation, but I don't think there's, the best way of offering schooling right now and keeping our kids safe, or feeling like our kids are safe. And a lot of families are feeling worried or stressed about, their child missing school or missing opportunities for learning. And I just want to remind, families that learning doesn't just take place at school. Learning is something that is lifelong. And just because they miss, certain content or certain time at school, it doesn't mean they're never going to learn their times tables or they're never going to learn how to do something. Learning is still going to happen. And there's a lot of learning opportunities that you can give your children at home, just cooking together and practicing measuring things, or, with my daughter going for a walk and pointing things out and talking about what we're seeing. There's a lot of learning you can provide to your children outside of school. What research tells us is that children learn best when they feel safe and they feel loved. So if that stress response is activated in your child in relation to school, then they're not going to be able to sit still and focus and pay attention and actually take in the content and retain the content if they're stressed. So the best thing that you can do, and what I've been recommending to families, is, prioritize connection. Prioritize the time you spend with your child. Help them to feel safe. Help them to feel like they're not alone, that you're there to help. Take lots of breaks during the day, and prioritize keeping a low stress environment versus you have to get all these academics done, because they're not going to cognitively be able to do the academics if they are stressed.
So I've got a question here. You talked about how avoidance can lead to more stress, and then you I don't know if you contradicted yourself, but you talked about not watching the news. Is that not just an avoidance of bad news and could possibly create more in the way of anxiety, wondering what's going on, like what's the latest outbreak stats or whatever it might be?
So thanks for calling me on that. So I give the example all the time in therapy of a kid learning how to ride their bike.
Okay.
And if the child is learning how to ride their bike, they fall, they break their arm. They might develop anxiety about riding the bike. They don't want to be on the bike. They don't want anything to do with it. They don't want to watch, it could get as far as, I don't want to watch TV shows with people riding bikes. I want nothing to do with bikes, because my brain has paired bike with threat, bike with harm. If the child never rides a bike in their life, they could avoid the bike. They could avoid everything to do with the bike, but it doesn't take the fear of the bike away. So we try to encourage the child to, maybe watch TV shows of people riding bikes or videos. Maybe you're just sitting on the bike. Maybe you're just having your hands on the handles. Maybe you're just pedaling for a foot. We gradually encourage people to face their fears so that we can, kind of break that pairing that the brain made between bike and harm. So for us, in our brain, COVID is harm, which it is. And so it's important that, we be aware that there is a lion out there, there's a threat out there. But again, with that, I was trying to do like a little graph on the screen, but when we have those acute stressors, there's a peak, right? If we want to be stressed enough so that we can keep ourselves safe and handle the stressor and be motivated to do something. But if we let the stress get too high, then it's going to impact our daily functioning. It's going to impact our performance. We're not able to cope. So when it comes to the news, you want enough so that you're motivated to keep safe and do things, but you don't want too much that you then can't function.
Right.
So it's about finding a balance.
I'm doing the exact same thing with the polls in the United States. I can't watch every article that flows through, but I can watch to see that they're still 10 points apart. So I do understand. And I think the other point to that is that it's personal too, right? So, that's something that has worked for you to help limit your anxieties about the situation. And that's something that clearly that you came to after a realization that looking at it nonstop was adding to it. So didn't mean to call you out there. Just
No, but I think that's an important point to clarify. It's about finding that balance between keeping yourself safe, but not inundating yourself with information. I encourage some of my clients to plan worry time, plan a time during the day where you will allow yourself to worry. So for me, that's first thing in the morning. Well, not first thing, usually when I'm having my cup of tea, and then after my daughter goes to bed, so that, you know, that information isn't impacting my interactions with her at the end of the day, kind of thing. So everyone's threshold is going to be different, but if you're spending all day, every day checking the news about COVID, then, you know, you're reaching that peak of stress. So how to support resiliency in your child, where, you know, it's human nature for us to gravitate to things that feel good and to avoid things that don't feel good. Child touches a hot stove, probably not going to do that again because it didn't feel good. So in a child's brain, when that stress response is activated and they actually feel like there's a lion out there, you know, they might not necessarily be motivated to want to face the fear or to do something about it. But you can encourage this in your child. So, you know, step number 1 is just to identify the emotion. Your child might not have the vocabulary or the insight to know that this upset stomach, that the sore pinky finger is related to worry or is related to stress. So help them to identify the emotion and then validate the emotion. Nobody wants to be told, you know, calm down, or you shouldn't be worried about that. Because you should be worried about a lion, or going back to school is hard and it's difficult after being out of school that long. It is tough. Validate the emotion. Encourage your child to ask themselves, what is the emotion telling you? Every emotion has a need, has a function. If you're worried, it's because you're not feeling safe. So then what can we do about it to help you to feel safe? Help your child to feel confident in their ability to handle the stress. You know, reminding them of the things they can control, the things they can do. You know, if your child's able to identify what kind of thoughts they're having in their head, encourage them to talk about those negative thoughts they're having. Encourage them to challenge them or try to think of them in other ways. You know, it doesn't have to be, okay, I'm thinking negative, so now I have to think positive. It's just looking for evidence. You know, I'm going to go to school, so I'm going to get COVID. You know, what's the evidence that it's like a 1-to-1 correlation, right? Just looking for evidence to feel better about it, to feel just okay. And then encourage use of coping strategies. Encourage them to do something to feel better. Go take a walk, do some deep breathing, have your favorite meal, just something to help you cope with that stress. And again, that co-regulation between the parent and caregiver and the child can be especially effective in that regard. And in terms of what we know about trauma and how trauma impacts children, some recommendations on that front. Again, being aware of the signs, symptoms, and impacts of trauma. So know what to look out for. If you notice a change in your child, you're noticing those themes in their play. You're noticing that they're more withdrawn. You know, don't be afraid to talk to them about it. Bring it out into the open. Help them to talk through it and figure it out. Prioritize and increase connection. Again, this is like probably my number 1 take home is when kids feel like they're not alone, when they feel supported and safe, they're going to be able to bounce back easier. Again, increasing structure and routine, predictability in the day, focusing on your child's strengths and helping them to feel confident in their ability to handle the lion. And again, being aware that your children aren't operating on full cylinders. So their attention span might be lower. They might have a harder time problem solving, figuring things out. So just being aware of that and taking a more supportive lens versus, having consequences because they forgot what you asked them to do or they didn't do something fast enough, that kind of thing.
Do you recommend you talk about talking and having the dialogue and clearly it's important to show them that you recognize what is going on. Do you recommend transparency with children? Like, you know, we've all, if we didn't before this presentation, we've all recognized how this has affected our anxiety now at this point in the presentation, 44 minutes in. Being transparent about the fact that it's happening to you too and disclosing that to the child, is that a good tactic?
I would completely agree. However, you also want to keep it like age appropriate. I'm not going to necessarily talk to my 2-year-old about my specific concerns about COVID. You still want to make it age appropriate. But anxiety and stress and fear are all normal. They're all adaptive emotions. We all experience them. So it's our job as parents and caregivers to teach our kids how to handle stress, how to persevere, how to push through and be resilient. And there's no better teacher than a parent or a caregiver. So talking to your kids openly, how are you feeling at school? Like, what are you worried about? Like, how is it going on? Like, what's going through your head? Being, again, talking about it explicitly in a way that they would understand. Maybe you have to say things a little more concrete or use certain terms or really explain things. But just encouraging them to get the thoughts out of their head, getting them, and if they're not able to do that, just encouraging them to, identifying, hey, you seem a little worried or you seem a little off. Let's do something about it. And then doing something together. And I get asked that question a lot when I work with families where there's a child who, is really struggling or concerns about self-harm. And some parents, have asked, well, if I ask them if they feel like hurting themselves, then they're going to do it. But that's not the case. Asking your kids if they're struggling is not going to make them struggle more.
Good point. So we're going to move on to how psychology can help now. A reminder to everyone, if you haven't submitted already, we are trying to get your questions answered. So feel free to enter them in the Ask a Question box below the video window. A time check for you, Stephanie, is we got about 15 minutes left. So I'm gonna leave you alone for a bit to go through this because I think it's important, clearly, as we've gone through this, to understand the role of a psychologist and what it can do for people in this state.
Definitely. So what is psychology? Basically, it's the study of how we think, feel, and behave. We study people. We study how we think, how we interact with the world for the reason of being able to predict how someone might behave or how they might react, to understand why someone might be doing what they're doing so that we can then help change whatever challenge or struggle someone is going through. There's different areas in psychology. So clinical psychology is where we specialize in, abnormal behavior or, mental diagnosis, psychological diagnoses. So the assessment, diagnosis, and treatment. Counseling, a little self-explanatory. You can specialize in school psychology, forensics, health, rehab, neuropsych. There's other ones, but those are kind of your top areas. And again, psychologists and psych associates, we are big picture people. So throughout our training, we develop a knowledge base in many different areas of human life: neurology, genetics, psychological functioning, social, cultural determinants of behavior. We specialize in different psychological disorders. So knowing if something is social anxiety or is it accounted for by, the withdrawal and depression. We know how to tease those things apart. We specialize in cognitive functioning and how the brain works, human development, academic achievement, personality, health, addiction, substance use, relationship and attachment. This list, there's probably more I could have put on here. But some psychologists do specialize in certain areas. So whereas most psychologists or psych associates would have a bit of knowledge in all these areas, some psychologists may specialize just in addictions and substance use. Some might specialize in working with autism, for example. So why is access to mental health support important for families, either with a child with autism or a parent who has a diagnosis of autism? It's important, in my opinion, because just having a diagnosis of autism makes someone more vulnerable or more likely to develop another psychological diagnosis. And the research says it can be as high as 70%, the overlap between having autism and another diagnosis. So if you have autism, or if your child has autism, mental health should be on your mind. And I think for a lot of families, they've acknowledged this, and we're seeing some changes coming up in OAP and that kind of thing to focus on mental health because it is so common. Some of the most common diagnoses: anxiety, depression, especially in our adolescents and adults on the spectrum. ADHD or attention problems, specific phobias, obsessive compulsive or oppositional behaviors. And these numbers and these diagnoses don't account for all the people who present with symptoms of other psychological diagnoses, but they don't necessarily meet criteria for social phobia or for a depressive episode, but yet they're showing a lot of the signs and symptoms that they would need support with. That being said, if someone is struggling with their mental health, it would warrant more specific intervention, more specific therapy or medication, whatever the situation might be, aside from what they're probably already getting. So if your child is, getting ABA services, then, definitely that can help with some areas like self-regulation or learning some coping strategies, but it's not a specific intervention to help with depression or to help with obsessive compulsive tendencies. It may warrant more specific psychological therapy or interventions. But in the research, there is some evidence to suggest that certain types of therapy are effective for our autistic population. But the research base definitely is not as large as it is for, the general population. Research shows that individuals with autism generally have poor access to mental health services because of their complex needs. And what I mean by this is, even though a psychologist or a psych associate gets training in a whole bunch of different areas and everyone would know about autism, it doesn't mean that everyone specializes in autism or knows how to tailor their interventions so that it works for the specific strengths and needs of someone with autism. So not all practitioners feel competent in their ability to work with someone who has autism. There are many who do, but there are many who don't. So especially living in Northern Ontario, that can really be a barrier to access because not everyone specializes in autism up here. So a psychologist can really play a variety of different roles when it comes to a child with autism, or if you have autism yourself. We can be part of, the whole team. We as psychologists serve a certain role. So you'd have, you might have a speech pathologist or a BCBA or school staff. Psychologists can play a certain role. And again, we're big picture people. We look at more than just behavior. And based on our assessments and our knowledge, if I do an assessment with a kiddo and we find that, his visual spatial skills, ability to solve problems in space, do things with your hands, if I find that that's really advanced compared to his other skills, then that can help with programming at school, or how the BCBA helps to program more of the behavior side of things. Again, each person with autism has a different profile and strengths and weaknesses, and that's really where I feel a psychologist or psych associate can really contribute to the treatment team. And psychologists or scientist practitioners, the area of psychology in general, we've done a lot of research when it comes to screening for autism, assessing for autism, and treating autism. So psychology has really always been in the forefront. We just might not be the first service that's activated once a child gets a diagnosis. So I won't spend too much time on this area, but I wanted to give people an idea of, what you can actually access when it comes to psychological services, because it's different and you might not know what to ask for or what to expect. So when it comes to the assessment side of things, there's different types of assessments that we do. So a psychological assessment is where we're focusing primarily on psychological functioning, emotions, personality, behavior, and how it's impacting their daily life. Assessments are fairly comprehensive, and we're, again, looking for many pieces to the puzzle. we're doing a lot of interviews, observations, questionnaires, and then you might get a diagnosis if it's applicable. So we might say, yes, this individual has autism. This individual meets criteria for generalized anxiety. And then we would give recommendations for treatment. How that's different from a psychoeducational assessment is that this type of assessment is primarily related to school. And we're looking at, where an individual's capacity is in terms of their IQ, and then how is that coming across or presenting in the classroom in terms of reading, writing, and math. So really the goal for this type of assessment is to see if there's a significant learning problem and how that's impacting their schooling. And then we can give recommendations for like an individualized education plan or some remediation at school. So psychoeducational is based on school and academics. Developmental assessment is to see where someone lies, where their skills lie in comparison to other people their age. So when we're looking at young children, we're trying to see, is there a delay in development? For adolescents and adults, this type of assessment is to see if there might be an intellectual disability. So this is the kind of assessment that, you would want done for your child if they're, about to enter adult services and they want to apply for Developmental Services Ontario, DSO. So they need to evidence that there's a developmental issue. Now, behavior assessment, not all psychologists do these types of assessments, but if they have the training and expertise in ABA, this type of assessment is to try and figure out why a behavior is happening. What's the context surrounding it, the triggers, the consequences, so that we can help to explain why it's happening and then to give recommendations on, what to do about it. So with an assessment, what to expect, usually it's 2, give or take, days. It can take place in a clinic, in the school, in the home. We look at all previous documentation, background history, lots of observations. We can assess various different areas. And then usually about 4 to 6 weeks after the assessment, some psychologists get the reports done sooner, some take a little longer, but that's probably around the average. You should meet with the psychologist or psych associate to review the findings. Ask your questions. What does this diagnosis mean? What does it mean for the future? What's the prognosis? Go over the recommendations. And you should get a copy of like a written report that you can then share with whoever you want to share with. You can also ask them to share the results or give feedback to the school or to the family doctor, that kind of thing. Now, in terms of interventions, psychologists and psych associates are identified as being able to offer psychotherapy. So that's a restricted act that we are able to do. Psychotherapy is a talk-based approach to help someone with their mental health and well-being. It can be individual, group format, couples, families. Now, there's different modalities of psychotherapy, but the essential components in each one is the importance of a therapeutic relationship. You need to trust the person you're working with. You need to feel safe. You need to feel comfortable enough to share what's going on, share your problems. It also requires a fairly, a high level of engagement. You have to want to do therapy because it is work. It is not easy. It's hard talking about problems and things that don't feel good. And you should always be working towards a certain goal. And again, in terms of the strategies, it could look a bit different depending on what modality the therapist is using. But, we are talking about the problem and trying to figure out ways of making it better. Now, when it comes to psychotherapy and autism, it's primarily focused on secondary issues. So, I'm not seeing an adult with autism to necessarily change their autistic symptoms. I'm working on their anxiety. I'm working on their depression. Or it might just be some psychoeducation, just learning about autism and how it's impacting their life kind of thing.
So Stephanie, we are about a minute before the
Oh, sorry, you're just cutting out there.
Do you got me?
Yes.
Okay. So I was just wondering if you're comfortable going on longer than 1 p.m. so that you can finish off your presentation.
Yeah, for sure. There isn't that much left.
Okay. So for everyone else who has to leave, reminder, this will be recorded and it will be available on demand on the Autism Ontario website. Also, before you go, check out the resources section. There's a number of topical items there, including the PowerPoint deck in both official languages and a link to donate. The more people that view these sessions and the way that we do them is through donations from the community. And so we've added that in the link as well. So Stephanie, I'm gonna leave it off to you to go ahead and finish the presentation. Anyone who has to go, you can catch us on the on-demand version. That'll be available by tomorrow on the Autism Ontario website.
Awesome, thank you. So when it comes to psychotherapy with an individual with autism, it's really also the modality is going to depend on, how impairing the symptoms of autism are. If I have an individual who uses augmentative communication to communicate with me, definitely can still do therapy. I just might tailor how I'm doing things. Or if there is an intellectual disability, I just might be a bit more concrete in terms of the language I'm using, or I'm going to focus more on the experiential aspect, the things you can do, as opposed to, just sitting and talking. So common psychotherapies in autism, cognitive behavior therapy is really kind of number one in terms of research evidence. Names of programs you might have heard: Coping Cat, Facing Your Fears, Cool Kids, that kind of thing. There's research evidence for group social skills programs. So like the Peers program has a CBT component as well. And there's also research to support the use of mindfulness with people who have autism as well. And just to evidence this, the National Autism Center conducted one of the largest literature reviews of various interventions for individuals with autism. And CBT, again, came out as one of the 14 evidence-based interventions. So really, that's probably my number one recommendation in terms of what type of therapy to look for. I definitely don't have time to get into what CBT is, but it's a time-limited, structured type therapy where, we're evaluating the thoughts people have, the feelings tied to those thoughts, and then the reactions that happen as a consequence of them. And then kind of how that pattern works, because it's different for each person. There's things we can do to help, explore the thoughts, process the thoughts, change them, challenge them. There's things we can do for the emotion and the physical aspect of an emotion. And then we can help to alter some of the reactions or behaviors. Some other psychological interventions that you might come across, behavior consultation. So, if there's a challenging behavior that we figured out what the function of it is, then, we can come up with a plan for how to intervene. Oftentimes I do a lot of coaching with families. Then, I can coach a parent or a caregiver to how to implement the strategies and how to do it at home. And Matt, I did see your message. I just don't know how to respond to you. So thank you for joining us today. Some other interventions: parenting support. I meet a lot with parents and caregivers just on how to manage things at home or support your child's mental health. I support schools very often. We can support siblings, family members, classmates, workshops, presentations, community outreach. The sky's kind of the limit. Some other mental health professionals to be aware of: a psychological associate, and I've said that a few times today, is the same as a psychologist. We do the same work. However, I did a PhD as a psychologist. A psych associate has a master's and then works supervised for 4 years. We do the same work. It's just different in terms of how we got there. There might be a psychologist who doesn't have a PhD. Usually that's because they were registered in another province in Canada and then came to Ontario. A psychiatrist, I'll talk about that in a second. There's a psychotherapist who specializes just in psychotherapy. You might see like mental health therapists or social workers often do some counseling and advocacy as well. Main difference between a psychologist and a psychiatrist is that a psychiatrist goes to medical school. I didn't go to medical school. I did a master's and a PhD. So because a psychiatrist went to medical school, they focus more on the biological aspects. So they're able to prescribe medication. They can still do assessment and therapy, but primarily their focus is on the biological aspect of what's going on. You can find us working in private clinics, hospitals, schools, agencies, universities, businesses, correctional facilities. We are kind of everywhere. One of the questions I get asked very often by parents is, what is the difference between what you do and what, my BCBA does, or what my behavioral technician does? So there is a lot of overlap and there are some differences. So applied behavior analysis is evidence-based techniques to increase positive and meaningful behaviors while also reducing, behaviors that are getting in the way of someone's ability to function. So this is based on operant conditioning, how we learn from our consequences, reinforcement and punishment. That is what ABA is. So specific techniques to improve quality of life, to teach skills, and reduce interfering behaviors. It's not psychotherapy. It's not talk therapy. But ABA is a branch of psychology. It's a branch of behavioral and learning areas of psychology. When it comes to someone who specializes in ABA, there is a credentialing body where, this is where someone who specializes in ABA could get certified as a board certified behavior analyst. So that means they have a master's, appropriate education in ABA, and then they wrote their exam to be registered. A psychologist who has a PhD could register as a BCBA at the doctoral level, or if you have a bachelor's. So there's a variety of different registrations you might see. But what I want to highlight is that not every psychologist specializes in ABA. Unless they have had specific training in ABA and experience in ABA, then most definitely they can provide that service. However, a BCBA can't do psychotherapy. They can't make diagnoses because they haven't had the education and background in psychology. So there's some overlap. But what I want you to take from this is you need to ask the questions in terms of what do you specialize in, so that you know if this is the best practitioner to work with your child. So how do you actually access us? Again, you want to look for people who specialize in autism, specialize in ABA and child development. You want to make sure that they understand that autism can be related to other diagnoses. Making sure that they're willing to either modify therapy or the intervention so that it works for you or your child. Keeping in mind that not all interventions will work for everyone, and it's about finding the right practitioner that works for you and that you have a good connection with. Again, doesn't necessarily mean that the intervention's going to always be effective, so keeping that in mind. So if you want more information about what a psychologist or psych associate does, the Canadian Psychological Association and the Ontario Psychological Association are two great resources that you can access. The College of Psychologists website is actually really great in that I was hoping at some point to pull it up, but I'm definitely over time. But if you go to their website, you can actually access the public register. So you can actually search for someone who's registered with the College of Psychologists. You can search based on their name, where they're located, to make sure that they work with children, that they work with adults. And the Autism Ontario provider and professional listing also identifies psych associates, psychologists who would be, trained and have area of expertise in autism and or ABA. So that was it. only 9 minutes over. So thank you for sticking around and bearing with me. I appreciate you guys joining me today. Feel free to send me an email, call the office if you have any other questions, or if you need some support. And again, psychologists are still here. We might be working, primarily virtually, but we're still here to support you. So don't hesitate to reach out if you need some help. Thank you so much for joining us today.